My dad's a very active guy, and at the time he was, in his mid-60s, and my mother called me one day and asked me to come up and take a look at him because he couldn't walk. His legs were hurting. He could barely even contract the muscles in his legs. He restores cars, he's gardening all the time, cutting wood, just a real busy kind of a guy. So I thought, well, he probably just has a sprain or a strain or something along that line. I asked if, he'd been doing anything different or out of the ordinary, and she goes, no, but, he went to the doctor the other day and he gave him a medication for his cholesterol and triglycerides. And he was taking a couple medications for diabetes, a couple medications for blood pressure. He also had some experience with some GERD or gastric reflux. We had a medication for that. I said, he doesn't need to be taking this stuff. And since that time, I've taken a real deep dive into understanding functional medicine, understanding root cause medicine, and really just not focusing on symptoms, but treating the cause of the problem. The symptoms just simply drop away. So that's kind of how I got here. Most of the patients I see come to me, they're just very frustrated. They're aggravated with, I think, the medical system. And we see people with a lot of complex problems, which I don't think really fit that typical medical model. Where you've got a symptom, here's the drug for it, and it works. Well, it just doesn't for them because they have so many different symptoms, so many of them. So because of the functional medicine model that we do use, we look at their health concerns in a different way, and by evaluating their history, other medications or other treatments they've had, we're able to then determine, well, what tests do they need that they haven't had? And a lot of times what we find is they've had a lot of testing, but not the right kind of testing. The patients have a story, and you can't understand that patient's history or their journey in 6 or 7 minutes. So we typically spend an hour or so with our patients or whatever it takes to really get a good picture as to what they've been through from a treatment perspective, but also their emotional journey and how it's affecting their lives, and also what kind of goals they have by the time they're finished with our office and moving on to the next phase of their life. When I say history, I'm talking about going back to the day they were born, literally, and we look at different health timelines and different antecedents or things that may be pre-existing problems, or maybe some genetic issues that could be a causative factor for them having to come to our office. By taking different component parts of the history, taking different component parts of the diagnostic testing that we perform, it starts to paint a pretty clear picture as to what and why they're having the problem. For the ultimate outcome of getting a patient well and keeping them well, they really need to understand what their condition is, what's caused it, and what they need to do on their own to prevent it from happening again. And it makes my job easier. I mean, if I have a patient that really understands why we're doing what we're doing, why we're changing their dietary program, or why we're changing their exercise program, if they understand why, they're going to comply better. They're going to be a better patient. Make it easier for me. You can have everything else in life going great. You can have a great spouse, you can have great kids, have a great job, have a great dog. But if you don't feel good, it's hard to be happy. A lot of the changes our patients make, their families make, so, it makes for just a healthier family, a healthier situation. We deal with a lot of patients with thyroid problems, adrenal problems, hormonal problems, patients that have GI problems, gut problems, irritable bowel problems, autoimmune problems. A lot of the patients we've seen have never even heard of functional medicine. They tell me a lot of times, I didn't know a doctor like you even existed. But I would certainly, get online, try to find a functional medicine doctor. If they want to contact me, we offer a free discovery call for all of our patients. And at our website, healthylifedoctors.com, you can get on that site, you can schedule that 15-minute discovery consultation, and we offer that via telephone. We do Zoom video conferencing, or they can do it face-to-face live, just come to the office. But it gives them an opportunity, I think, to see if it's something I can help them with, but also gives me an opportunity to let them know how we do what we do.